WisconsinEye's Campaign 2024 programming is sponsored by Wisconsin Counties Association, Nicolet National Bank, Wisconsin Hospital Association, Operating Engineers Local 139, the Wisconsin Realtors Association, the Wisconsin Laborers District Council, and North Central State's Regional Council of Carpenters. To support programs like this, please consider a tax-deductible donation at wiseye.org/donate or by texting WisEye to 44321.
Brienne Brown of Whitewater is the Democratic candidate for the 43rd Assembly District. The election is November 5th. Brienne Brown, welcome to WisconsinEye.
Hi, nice to be here.
Thanks for participating in this candidate interview. I want to start with, what's your campaign's key message? Why are you running for this office?
I would say we have a couple of key messages. One is restoring women's reproductive rights in Wisconsin, and another one's definitely education. We want to make sure that that K through 12 is being taken care of in the education level, and my district that I'm running for has University of Wisconsin-Whitewater there, and making sure that we're looking at colleges and redoing the formula for how the colleges here in Wisconsin are funded.
If elected, what's an example of a bill you would introduce and why?
Well, I would say that definitely a bill that I would introduce is simply to rescind Act 10. Act 10 is definitely a bill that came up in the Walker administration and really destroyed the unions for teachers, and what is done after that is essentially, in some ways, destroyed communities. I mean, many small communities revolve around their schools and their school districts, and when you have teachers who are constantly getting poached from other school districts or simply burning out because they're not getting paid well enough, and each year losing more money because insurance costs are going up and they're not getting any raises, that could be really devastating to a community as well as a school district.
If you're elected, you'd be coming into the legislature during a biennial budget year. Mm-hmm. Wisconsin currently has more than $3 billion surplus. What would be your top two priorities for spending that budget surplus?
Shared revenue. So currently I'm on the City Council in Whitewater, and also knowing how the city is struggling just trying to pay for things like fire, EMS, police department. We'll probably even have to go to referendum for our police department. So essentially looking at where that money is at the state level and understanding that, a lot of this was income tax that people paid to the state thinking it was going to come back to their cities and schools, and it hasn't. That's probably why we have a budget surplus, is because that money was essentially drained from the cities and from the school districts over a period of about 15 years. So I would really like to look at that formula and make sure that those cities and school districts are getting the money that we all think we're paying into the system for them.
You didn't mention tax cuts or tax reform. Would that be a priority for use of that surplus in any way?
I really think that the middle class is getting taxed enough. What I would like to see is more of the mega rich getting more taxes. There's also essentially, making sure that marijuana is possibly legalized, because that's billions of dollars that we're giving to Illinois and Minnesota and Michigan right now that could be also going into our education systems, somewhat like how Colorado does it. I think maybe some tax cuts, but probably more taxes for the wealthier. And we're talking mega rich. We're not talking people who just are, upper middle class.
You mentioned education as a priority for you. Certainly K-12 education is a leading issue for many Wisconsin voters. What's your campaign's top priority for K-12 education? What needs to change in that area?
Essentially, there's so many things. So if we could, first of all, make sure that teachers are paid well enough and that they feel like this is a rewarding job, that they're getting paid well and they can retire with dignity. That would be fantastic. So rescinding Act 10 would be fantastic. But there's also the concept of charter schools. I mean, some of the things that we don't realize is that charter schools, it's essentially a secondary education system that we're funding with public funds.
A private school choice.
The private school choice. So private schools are getting reimbursed for things like special education at 90%, and public schools are getting reimbursed for special education at about 33%. Anytime any money goes into the public school system, if those rates are raised, they automatically get raised for the charter schools as well. So we're essentially funding two systems with our public monies, and that is one of those things that we need to be looking a lot harder at. I mean, if you're going to get a child who has special needs who goes to a private school, that money needs to either follow them as they go through the school system, because often private schools they have a high history of like kicking those children out, but they get to keep the money essentially. So a lot of school districts went to referendum in April. About 100 plus school districts went to referendum in April strictly for operational costs because they weren't getting enough money from the state as promised. And a lot of that money was going to charter schools, as well as the fact that that they weren't getting that amount of money for special ed. So many of the school districts, I think about 25% of them, if they had just gotten those levels of special ed money for their school districts, they wouldn't have had to go to operational referendum. So we need to be looking a lot harder at why we're funding charter schools in the first place, private charter schools with public money. And if we're going to do it, we need to make them accountable and make sure that they are spending the money in the same way and answering the same questions that the public schools are answering.
You mentioned that your district is home to a university, four-year university. What does the future of Wisconsin's higher education system for and two-year colleges as well as technical colleges look like to you, and what changes does the legislature need to focus on?
The legislature needs to look at that formula for them as well. For instance, UW-Whitewater is one of the lowest funded colleges in the system, and one of the reasons why the legislature gets away with not giving them as much money is because they depend a lot on out-of-state students to come to, for instance, from Illinois, to come to the school. So the professors there haven't gotten a raise in about 10 years. And you have admin as well who haven't gotten a raise either. And even last year, there were promised, raises just for, cost of living that were essentially that the legislature didn't even let them have. So there were a lot of people, including janitors, who weren't getting cost of living raises. So some of that just needs to change. I mean, we have professors who are burning out. We have professors who are looking for jobs elsewhere, and these are tenure track and tenured professors who really, this should be their forever school. And they're essentially looking for jobs out of state because they're not getting paid well, they're not getting the raises they need, they're not getting the support they need in terms of, just even admin support. So I would say that the whole system needs to be looked at and renegotiated in terms of the funding model, because it's not working. Education is the most important thing that keeps our citizenry going, and if we start chipping away at education as we have been for the last 15 years, we are not going to have a great education system anymore, and we are not going to be able to attract people to Wisconsin, and we're not going to be able to keep people here.
What do you see as the state's largest workforce development challenge, and how would you propose to address it as a legislator?
Wow, that's a pretty nuanced question too. I think workforce development there needs to be a lot of training in place. When Wisconsin became a right-to-work state, that really decimated the unions, and unions have a long history of not just advocating for their workers, but also giving them job skills and training. And when I go knocking door to door, I often hear people complaining, these kids, they don't know how to work anymore. Well, partially when you go to high school, you do learn skill sets, but you don't learn all the skill sets. You go into, tech school, or you go to work for the carpenters, and you learn a lot of those skill sets through the union, et cetera. So in terms of job, development, we need to make sure that the tech schools are getting the money they need for helping people learn their skill sets, but we also need to make sure that we're actually supporting unions, because they're doing a lot of that training that's absolutely necessary.
Another workforce question. Investments in public and energy infrastructure grow our state's economy. These investments also provide an opportunity to invest in our state's workforce, but currently there are no requirements for hiring local workers. Would you support a state resident hiring requirement for state, local, and utility scale infrastructure investments?
I'm not sure I would call it a requirement, but I would definitely say in terms of carrots and sticks, I would go for the carrot. If you're going to be doing something large scale, I mean, I think there should be some subsidies or some sort of a reward for hiring local. I mean, if it's a really big job, it may be that you need to hire some people from Illinois or out of state. I get that. But if you can prioritize Wisconsin workers, and there's some sort of a reward for prioritizing Wisconsin workers, I think that is the way to go at first.
Employee classification is an issue in the construction industry. Some employers misclassify workers as independent contractors or pay them in cash off the books. This lowers costs by avoiding payroll taxes and unemployment insurance, but it puts compliant companies at a disadvantage when bidding on projects. Plus, misclassified workers may be denied minimum wage protections or overtime pay. Are you aware of this issue, and what do you think should be done about it?
I am very aware of this issue, and I actually spent some time in Texas, which is a right-to-work state, and a lot of the Texas economy is based off of that. It's dangerous for workers to be in a situation where they don't have a chance at overtime, or if they're getting paid in such a way where it's off the books. We need, again, to make sure that the companies are trying to follow rules that are good for their workers, things that keep their workers safe and keep them well paid. So again, I always prefer carrot over stick. Sometimes you have to do is use the stick if the companies are finding loopholes and ways around things. But the workers are the ones who produce the goods. They're the ones who make the economy run, and we need to make sure that they're protected and that they have roofs over their heads. And if they're not getting paid in a way that takes care of their basic needs, then we have a problem.
Affordable rental housing is an issue in Wisconsin. Some have proposed government-imposed rent control to maintain affordability, while others argue that keeping rent artificially low will decrease rental supply, resulting in increased prices. What's your sense of housing as an issue in your district, and which best addresses rental housing affordability? Is it rent control or building more rental housing?
I think building more rental housing. I mean, rent control has been used in places. It has been used well in places. It hasn't been used well in places as well. So there is a lot of nuance to that. In Whitewater, for instance, we haven't built anything new in about 40 years, and so everybody's mortgages are high, the rents are high, simply because people have a roof over their head, even if it's 30 or 40 or 50 years old. So the more rental housing that you can build, the better. The problem is a lot of the time when you're building rentals, you need to make sure that the developer wants to build there, which means they often need a subsidy of some sort to make it worth their while. Small towns who also need rental housing don't have that tax base to be able to, give a little bit of a subsidy, and right now their only tool is TIF funding. So I would say we do need more rentals built, and we need more compact, walkable neighborhoods built, so that we're not building into farmland, et cetera. But it's really, really important also that we figure out a way to be able to subsidize that housing so that these smaller towns can afford to get developers to come there. Right now, Whitewater and Edgerton and Milton, some of the other towns that I would represent, all have a really difficult time getting developers to even look at the town, even when they have land to give away.
Medical systems are facing numerous headwinds in the form of inflation, workforce development, and issues around Medicare and Medicaid reimbursement, resulting in fewer services and even the closure of a hospital system in western Wisconsin. What would you do to preserve access to care and prevent future closures?
I think one of the first things, and this has been in the news a lot because it's really a great idea, is taking that federal money and making sure that we use it for Medicaid Badger Care. That is money that we have all spent in taxes to the federal system. It should be coming back and helping us. And the way it works out is a lot of hospitals need that Medicare Badger Care funding for making their EMS vehicles run. Right now, Fulton, which is in my district, is shutting down transfer care with EMS vehicles because they just can't afford to do it. So if you have that Medicare funding it, you can actually run your EMS system. Also, rural hospitals really rely on Medicare and Medicaid because often people who are in the rural areas are older or have less of an income, and they really need to make sure that that's what keeps their hospital open. There are a lot of problems with, an excessive amount of fees with insurance companies and sometimes hospitals. It kind of depends on if it's a big conglomerate or not. But the essential thing is we need to make sure that we are keeping our hospitals running, and if making sure that we're accessing that federal money is one way to do it, that's a great way to start.
Mental health care is a growing concern for Wisconsinites and concern also for state and county budgets. In your district, what are you hearing on this issue and how would you address mental health care?
So we have a great hospital nearby that is helping us a little bit with putting mental health care in the high school, and that's a wonderful thing. So, and also our Walworth County Sheriff Department has given us a social worker for our police department. It's not enough, but it's a start, and even the police department is just amazed at how much help they've gotten and how it's taken their job to a different place where they don't have to worry about somebody who might have a chronic mental health issue. So I think what we need to be doing is making sure that we have more social workers. There's a shortage right now in Wisconsin, making sure that they're paid well and making sure that they're licensed, but also having them integrated more in places like our police department and sheriff's department, et cetera. We are seeing great benefits from it with just one person in Whitewater, and I think that if we could expand that a little bit, that would be fantastic.
How should Wisconsin move forward on the issue of abortion? Do you have a position on whether there should be different limits or exceptions in Wisconsin law?
I really think people should just get out of the business of women and their reproductive decisions. And I personally would be an advocate for getting rid of that 1849 Wisconsin law that exists on the books right now. From what I understand, Robin Voss is going to try to put some 14-week constitutional amendment on maybe even the next ballot. And it is such a complicated situation, whether it is a woman who's had difficulties with a pregnancy the whole time, or somebody like me. For instance, I was considered a geriatric mom when I had my first kid at 35. So would you have people having babies at different ages? Some women can have babies even in their 50s and 60s, and maybe they don't want to. It's really the largest economic decision a woman in a family can make, and I think it behooves politicians to stay out of their business and let the doctor and the woman and possibly her priest, whoever she works with and talks to make those decisions by themselves, because honestly, politicians have no idea how complicated pregnancy can be.
Shifting to the issue of transportation, what are the pressing transportation needs in your district, and how important is it that these needs are addressed and for the state to keep on schedule with the reconstruction of our aging interstates and significant corridors of commerce?
So this is a really interesting question, especially for Whitewater, because Whitewater is in 3 counties. So some transportation is available as long as you stay within your county. And there are people who need to get transportation to, let's say, a free clinic in another county, which may only be 15 miles away, but they can't get that transportation across county lines. Also, our town, even though it's relatively small, has a food desert in it, which means there are people who can't actually get from one side of town to the other and go grocery shopping. We have something called, it's a shared ride service, which is not terribly reliable. It tends to pick up other people on the way, and so something that should be a 5-minute ride can sometimes take an hour to get across town, and that's just across town. So I would say I'm a huge advocate of making sure that we're making sure that pedestrian and bike lanes are available, that we get some more railroad spurs, that we're actually thinking more about public transportation. Even in little towns, you can have like little electric buses that are only like 12-person buses, but maybe have like a certain route or a certain cycle. This is what I did my master's work in, was geographical health and how people get around, and how your actual chronic health has a lot to do with what's happening with your transportation options. People who have very low income, like in Whitewater, which is $37,000 for a family per year, many of them, their biggest expense is a car, and often their car breaks down a lot. So we need to think a little bit harder about how to get people over county lines, over to the courthouse, to the hospital, without having to figure out how to get them a car.
PFAS, other water contaminants, are a concern for a growing number of Wisconsinites. Do you see this as an important issue, and how would you address it?
Yeah, absolutely. So I actually have a background in chronic disease epidemiology, and that's what we focused on, was water quality, lead poisoning, pesticide poisoning, PFAS, that type of thing. And I would say that, the beautiful thing about Wisconsin is we have lots of water, but we need to make sure we keep our water clean, especially with climate change happening. There are parts of the country that they don't have water anymore, and they're rapidly losing their water supply. We're going to start getting climate refugees here in the next 15, 20 years. I already know families who've moved here from California. So we need to make sure that we're actually paying attention to our water quality and making sure that we're not causing more chronic diseases because people are drinking bad water. We have some of the best, cleanest water in the world, and the most of it. I mean, a very large water supply, and we need to make sure we're keeping it clean.
How would you describe the leading differences between you and your opponent?
I would say that I am incredibly ethical, and when I say that I believe in something, I'm going to vote on that. I'm also a scientist by training, so if I get new information and new data, I'm willing to change my mind if there's new data that shows that there's a better way to do things. My opponent talks a game about being a moderate, but then when you look at his voting record, it is right-wing all the way down the line, says he believes in education, doesn't vote for education. So my feeling is, you need to have a spine. This is one of those places where you need to do a lot of talking with people and understanding where they're coming from, but you also need to be representing your constituents. And I know for a fact from knocking on doors that my constituents want better education. They want better health care. They don't want to be one injury away from bankruptcy, and they want to make sure that their water is clean, and they want to make sure that they're safe and that their police department, fire, and EMS are being paid for.
Final question. If you could have a magic wand over the state capitol and have just one issue resolved that brings people together, what would that issue be? I really think education brings people together. Everybody cares about that. It doesn't matter what political persuasion people have. When you talk to them about their kids getting educated well, that their kids, can someday have a great job or go to a great school, everybody cares about that. So I think if we could just wave the wand and make sure that all of our education is fully funded, that our teachers are really happy with their jobs and they want to stay in their jobs because they're getting paid and respected. If we could do that from K through 12 and then in the university system, I think a lot of people would be happier. Well, thank you very much, Brienne Brown from Whitewater, the Democratic candidate in the 43rd Assembly District. The election is November 5th. Brienne, thank you for talking with WisconsinEye.
Thanks. Appreciate it.
This programming is brought to you by our generous sponsors. Thank you for watching.